place to talk about healthy living and beautiful life. We have, talked about balance in life, talked about how to look beautiful from inside out. And this episode is going to focus on acne scar. Well, our last episode has been talking about acne, so it's a logical subsequent topic. Acne can be bothersome. We were talking about that. There are things we do to prevent it. You know, if you have done everything you can, you still end up with acne scar. That's pretty bad.
Yeah, it's sad because it's something that in many cases isn't your fault, or maybe when you were young, sometimes acne scars come on their own. Sometimes it's because we were just so embarrassed about it and we overworked ourselves over. We're going to talk about that, how to handle.
Fortunately, for the majority of us who have acne scars, it's something that's annoying.
Mm-hmm.
It's obvious to yourself, but it's not so obvious to other people.
It's true. It's true. In fact, I just remembered that I have one acne scar somewhere on my face, and I have no idea where it is. So if I don't even know where it is, then probably other people don't either.
A small portion of us are not this lucky, and they actually have more severe, more visible scarring. And that's the kind of scar we're going to focus on more.
Mm-hmm.
But we'll talk about some mild things, non-invasive, and home remedy things for the mild ones too.
Sure.
So, first of all, what does a acne scar look like? Like the serious ones. There are different types. Usually the most common three types are atrophic ones, meaning that they are concave. They're like shrinking down. They're
so that's where the word the pock marks.
Right, the dents.
Yeah.
And that's usually shallow, not as deep. And the second kind is they say boxcar shaped. And the third kind is ice pick shaped. Those are really deep, narrow.
Mm-hmm.
Some people also consider darkening of the skin as acne scar, and sometimes there is also a red color inside the scar. We call it hyperpigmentation. Usually that happens in darker skin tone people.
Gotcha.
And also the redness that's inside the scar usually happens more often with the lighter skin tone people, and they're called erythema. That's a medical term for redness. So, those are the most common kind of acne scars, what can we do to make it worse or better? What do we do? These are the common sense things. Some people think, sun exposure will actually kill acne as you get under the sun. Actually, there are some people talking about that.
Oh, wow.
Yeah, there is some truth to it, such as blue light.
Okay.
That's used for acne treatment.
Which we talked about level on last time.
Yes, but you just using blue light itself.
Okay.
You have some, blue light itself has some antibacterial capability.
Gotcha.
But the sun has obviously blue light in it, sunlight.
Okay.
But sunlight has more. It has the ultraviolet, which is not always desirable, which can cause cancer in the higher dose, and can also cause hyperpigmentation, especially in a inflammatory state, which is infection is part of that. So avoiding sun is going to be better. Sun will make it worse. Another thing that you want to avoid doing is picking or squeezing.
Right, which it's so embarrassing.
Hard.
It's so hard,
tempting.
especially because you don't. I remember I had an intern. This is like 20 years ago. Who? Well, no, not 20. It's about 12 years ago. An intern who she's commendable. She never ever squeezed them. So she had like just white ones all over her face, and the urge is so strong. You want to just
help her.
Yeah. All right, keep going.
Well, there's also a reasoning under why you shouldn't be picking or squeezing. With the right tool and the right kind of, decompressing, it's helpful, but you can't accomplish that brightness with your fingernail.
Right.
So, when you're using your you're doing it yourself at home, you're more likely to compress the sebum, which is the plug in your pore. Half of it up, coming out, half it down.
I see.
You can actually make the
Worse
infection worse.
infection.
Correct. So, another thing is, when the infection goes really deep, it destroys the collagen.
Oh.
That's why you have those scars.
Oh. And why it's uneven, because there's
Right.
uneven distribution of the
Correct.
collagen.
Yeah.
Interesting.
We didn't mention some of those uncommon kinds of scars. One of them is called hypertrophic, which is like keloid. You overgrow the thickening of the scar instead of pocket or dent.
I see.
So those are rare, but
Uh-huh.
it can happen too. But anyways, when you cause more inflammation, you cause deeper infection is
Uh-huh.
when you have higher risk of having worse kind of scar.
If you do have acne, you have active acne right now, and you're wondering if it's going to cause some scarring, or maybe you cause a little bit of scarring, this show is archived. If you take some notes, but if the information has already gone past you, it's archived. It's also filmed and put up on YouTube. So make sure you take these notes, because this is literally life-changing information for you to not get those scars if you could prevent them.
Absolutely. Another thing is so important, things not to do to make things worse, is using scar cream or vitamin E. Can you believe that?
Not to do it?
Mm-hmm.
Interesting. Tell us why. Do we know?
Yes.
Okay.
Yes, absolutely. Most people are considering themselves having acne scar or any scar too soon.
Mm-hmm.
Well, they're not a scar yet. They're just the wounds. Their wound. It's not really healed yet.
Okay.
If you're putting scar cream or vitamin E too early to the acne site,
Okay.
which is not completely healed, not completely becoming a mature scar, you are actually going to irritate the wound. It's going to heal with bigger, worse scar. That is why you do not put anything on these things until it's like white. It's been a year, at least 6 months.
Wow. I didn't know that.
Yeah, it can actually cause more irritation and dermatitis
Okay.
with vitamin E. Now, a year later, if you truly have a hypertrophic scar, which is the overgrowth one, yes, then you can, at that point, you can use scar cream, vitamin E, and other things. We're going to talk about those things too, those natural, healthy things that you can do to help.
Got it.
So these are the common things that we want to remind our listeners not to do to make acne scar worse. So, what can you do to make it better? Right?
Yes. And once you already have them. So in other words, those days have passed. Fast forward 5 years, 10 years, 20 years, whatever it is for you, and you have
Right.
some acne scars.
Or maybe just weeks.
Or even
months.
weeks. Yeah.
Yes.
So in other words, you have existing acne scars. What do you do?
Right. Or fresh scars. It's healed, but it still looks discolorated and looks red for too long, or just looks not right, not liking it.
Mm-hmm.
So cortisone creams or fake creams, those things
Oh.
over the counter can be used
Okay.
at more earlier stage. They'll
Okay.
help to calm down the inflammation, hopefully reduce the post-inflammatory hyperpigmentation. We call it PIH.
Okay.
Hydroquinone is a popular ingredient in the fake cream.
Mm-hmm.
Actually, it is going out of fashion somewhat.
Yeah, I did some research on that, and it's in small doses maybe, but be careful.
Right.
Yeah.
It's just kind of fading out of the favor
Mm-hmm.
for concerns like causing cancer.
Right.
It's really not meant for long-term use. You use too little of it, you don't see results. You use too much of it, you worry about the things you worry about.
Right.
So,
And besides, in my opinion, it didn't really work. I actually did use it for a little bit till I did the research, and it didn't fade things.
you may
It
have
didn't.
too high an expectation.
Maybe I did.
So
I wanted a yacht, and all I got was a canoe.
So, in my opinion,
Mhm.
things, I mean, nothing works 100%. Nothing is magical.
Mhm.
These things, medication or natural remedies, they all have some effect.
Mhm.
Shouldn't expect anything to be magical.
Right, it's a combination effect of things.
Right. It
E-
takes the body to heal.
Even though I do have to say this, is that after I wasn't able to get the hydrocodone, is that the right? Hydroquinone to work properly, I went to Arizona Laser and Skin, and they got things to work properly. So we'll talk about that
we
later.
have,
Yeah.
alternatives and high tech.
Mhm.
There are so many things you can do. That's one thing I do want to mention. If you do end up doing everything, still end up having acne scars, you don't have to suffer.
Mhm.
There are definitely alternatives and choices to make to get rid of them. The technology is out there.
Right.
Yeah.
And we'll talk about it too, because it's great stuff. You should all know about it.
So hydroquinone is not popular. So what's in fashion, what's more popular now is things like kojic acid.
Mm-hmm.
That's actually a extract from a mushroom.
Oh.
It's a more natural, plant-based chemical that's considered safer.
Okay.
And there's also arbutin. That's a bearberry extract that's popular in the new fate cream.
Okay.
And vitamin C is actually a well-known lightener.
Is it topically applied?
Topically, yes.
Okay,
So when you're getting the fate creams,
Mm-hmm.
look for those ingredients inside the creams.
Okay.
So those are the good ones, natural ones. So for acne scars, unfortunately, there's no cream that can fill in the indentation of the acne scars. So that part doesn't, the over-the-counter stuff doesn't work.
But Arizona Laser and Skin has some good ideas for you, so hold the line on that one. Keep going.
Absolutely. No, we're going to go right into the
Mhm.
treatment of lasers,
Mhm.
laser treatment and filler.
Oh, okay. Very good.
So when you do have indentation or acne scar that's uneven, like we described before, laser treatment and fillers are the mainstay of the treatment. Very effective, most popular, and most people get results that satisfy them.
Great.
So people usually come up with the question, what's the best treatment for acne scar? What do you think?
Well,
Prevention.
yeah, you raised a trick question.
It is trick. But if you think about it,
Prevention.
it's hard to describe what's best for anything. Like, are we the best country in the world?
Trick
Is
question.
your wife the most beautiful woman?
That's not a trick question. She is.
So, well, good. So the best treatment for acne scar is prevention. We're going to talk about that a little bit more when we come back. And we also will go over the high-tech treatments and all the choices. And don't go far away. This is Dr. Tong Lee with Ageless Living.
And Kurt Wihelm, the co-host, and we'll be right back after the break.